And just look, can you see me? Can you see me? Okay, just hold it steady with both hands and relax. We are here today to ask some questions, to get some answers, and to ask the children.
More than 30 years ago, Pedro Espada began his fight for Bronx residents. He wanted to make a difference for the medically underserved, the forgotten, the elderly, children, and struggling families. He wanted to help the lives of people who lived in some of the nation's poorest communities, people whose voices were not being heard. He wanted to bring them hope, hope for their children and a brighter future. But even he could not imagine scripting this real-life American dream and a lifetime of dedicated service that has touched, for the better, so many thousands of lives. Senator Espada was born in Coamo, Puerto Rico, and raised in Monterrey. His parents came here seeking a better life for their children, but they struggled much like today's families, surviving on public assistance. He attended public schools, determined to lift himself from the welfare rolls, and he did. He received a bachelor's degree from Fordham University and studied public health and social work at other renowned institutions. He became a bilingual teacher and community organizer. It wasn't long before he was serving as founding president of the Stevenson Commons Tenant Association, advocating for 3,000 residents. This young man from Puerto Rico was fast becoming a role model of empowerment.
Senator Espada has been a successful businessman in developing one of the most important healthcare organizations in the Bronx, serves thousands of Bronx sites. Why not continue in that vein? Why not put all your energies toward private business? Leave the politics behind, be a real good, effective business person in the Bronx with understanding of how politics works, and fight for community change in that way, where you'll really be able to, in essence, put your money where your mouth is. Why even bother going through all of it?
That's a great question, and we could spend a whole hour, and in fact, I'll give you a copy of my book. It gets right into that question. But truthfully,
Pedro Espada's first-hand experience with poverty was the driving force behind his commitment to helping young fathers find jobs that would allow them to support their families. It was the reason he established daycare and youth programs, fostering early childhood development and good nutrition. It is the reason he started a food distribution initiative to help families feed healthy meals to their children.
Because he has heard of our work. And Carmen, I think, best exemplifies some of the moral inconsistencies in some of these principles that we're supposed to be preserving. Namely,
Pedro Espada has always responded to families in need, no matter what the need. For example, mothers left to raise their families alone while their spouse is serving our country. In this new age of terrorism, this is happening more frequently. He will continue to advocate for these families, to see that they are being taken care of. In 1978, Pedro Espada addressed a dire need: quality, affordable health care for people who were using hospital emergency rooms as their primary doctor. He established the Soundview Healthcare Network, aimed at providing such care for rural residents living in medically underserved neighborhoods, mostly lower income and minority populations. From a small office with one doctor and nurse, he has built this vital community-based healthcare network into 5 medical centers with over 200 physician specialists, nurses, and other support staff that meet the healthcare needs of the entire Bronx population. The network sees well over 100,000 patient visits each year, serving children, families, and the elderly. In addition, it provides educational outreach for a number of health issues. For example, nutrition, adult and juvenile asthma and diabetes, heart disease, and teen pregnancy.
You get out of the house, no matter what. I don't want to hear about it. especially music.